Welcome. My name is Calliope, and I'm going to be performing your examination today. How you doing today? I hope by the time you leave my office, you feel even just the littlest bit better. Would you mind just confirming your name and your date of birth? Okay. Excellent. And is that the name you prefer to go by? Do you have one you'd like better? Nickname? Anything like that? Excellent. I'm just going to have a quick look at you to see if there's anything I need to hone in on immediately. So we have the head, shoulders, the chest and arms, legs, the face. Do you mind if I get in closer here? Okay. Do you have something in your eyes? Do you have something happen there? Let me grab my light real quick. Let's start with a gentle one. Okay, so just look straight ahead. Okay, that looks quite irritated, quite red. I'm just going to pull down on the eyelid if you don't mind. Okay, start with one here. Okay. And pull up here. See, and the other side. Okay, and down. Okay, well, I don't see anything actually in the eye at all, but they look quite inflamed. Do you suffer from any seasonal allergies at all? I mean, the goldenrod is in peak bloom right now. That's a pretty sensitive one. Ragweed, certainly. Well, if you wouldn't mind, we can rinse out your eyes a little bit and see if we can reduce that irritation. Okay? Let me just grab my little eye wash here. And I'm going to tilt your head up. So if you could just let me take the weight of your head here. We're just going to go up like this. Okay. And I'm going to have you try to keep your eyes open. I'm going to hold onto your eyelid here. And we're just going to do a few. Okay. There we go. On the other side, I'm just going to hold this eyelid open. Okay. Your eyes are going to be a little wet for a moment. We'll just do a little bit more here. And this side. Okay. Just put this back on. And we'll keep an eye on that. So let's go ahead. We're going to bring you down here. Just gently. Just like that, okay? And why don't we get you cleaned up? A couple of cotton balls. There we are. And I'm just going to wipe around the eye. Start up here. And below. Are you experiencing any more irritation? Any burning? Okay. Just above the eye and below. And then we'll get the cheeks here. And then a dry one to just get any little bits of moisture rather. Okay. There. So we'll keep an eye on that and see if that improves that redness and irritation. Now, back to the regularly scheduled programming. Let's go ahead and take a little peek at your head here. I'm going to be palpating, looking through the hair a bit. So if you could just hold still and let me know if there's any pain or tenderness at all. Just looking at the hair's texture. Good. Feeling the scalp. And if it is more on the oily side, more on the dry side, if there are any little lumps or bumps. Hair over here. Seeing if there is any sort of hair loss, alopecia. See if there are any hairs left on my fingers when I run them through your hair. Any more than 10, and we might be dealing with a sort of hair loss. And just running behind the ears here. Behind the ears. Along the mastoid process here. Okay. All right. Done crowding around you there. Let's move on to your ears. They're a little I just touch the ears a bit? Mm-hmm. Okay. Why don't we clean that up a bit? It'll just take us a minute. Couple cotton buds, or balls rather. Alright, and let's see how we do with just the dry cotton ball here. Does that feel okay? No, I wonder. It's been pretty windy out there, hasn't it? Yes, this just primarily looks like dust. Coming off real easy. Good. Okay. Let me see. Got a little cotton bud. I'm gonna try to get in these little crevices here. We'll see how that works. Good. Okay. Just cleaning everything a little bit. Makes it easier to see the skin. That way we don't miss anything. Okay, and let me just see the back of the ear here. Get back there as well. Let's take a little look. Okay, that's a lot better. There we go. I know the wind's been something fierce lately, hasn't it? It's nice that it's a lot cooler, but that means it is quite windy. I actually had, of all things, I was outside and my hostas are blooming, and that means our house is chock full of little fuzzy bumblebees. Well, a little bit of wind came and knocked one of the bumblebees out of the hosta flower and hit my chest and bounced off again. Oh, it was quite cute. Why don't we take a little peek inside the ears now that we know the external ear is all clean. I've already looked at the back of the ear. So I'm going to have you stay still. I am going to keep my hand propped up so that if you do move, I'm not going to bump into you here, but I'm just going to have you look straight ahead here. Let's pull the ear up and back, and then just like that. Okay. Now looking into the ear here, looks like it does have a little bit of that dust in there, which makes sense considering. that can help. Looks like there's not really a lot of serum in here, so I don't expect that will impact that very much. Just gonna recommend that you do that, and that'll just keep the ears clean. But now we'll look at the other one. Go up and back, and then in terms of the ears, so the first ear, we had the correct color on the tympanic membrane and ear canal. It doesn't look like there's any coloring to it rather than just flesh, which is good. And it looks like everything else is non-irritated, no perforation. Looks like you do have the cone of light there. So yeah, just a little bit of peroxide, a drop or two in the ear. It'll bubble for a little bit, but you really don't even need it to do that, and just suction it back out with your hand, and then that'll take care of that bit of dust in there. If you do find that your ears become irritated or you experience any pain, then you can give us a call, and maybe something a little more substantial than just a bit of dust is going on in there, but everything clears as far as I can see. Now let's take a peek at the nose, the mouth, the throat here. Tongue depressor. Light. And that should be it for now. So if I can have you tip your head back. This is not going to go in the nose, but will be quite close. And we'll just look at the internal nose, nasal passages here. Okay. No deviation in the septum, no perforation. Tissues clear. And pink, moist. Terminates look good. Let's just see a little bit. Yeah, there we go. Yeah, no, those are good. Okay. And if I could have you open your mouth. Again, this is not going to go inside the mouth. I just want to look at the teeth. And can you lift the tongue to the roof of the mouth? Good. And put it back down. I'm just going to put this in the pockets of the cheek here. And I can look at the salivary glands and the buccal mucosa here, all these tissues. Okay. Good. And can you show me your teeth? Can you pull back the lip? I can look at the gums. Yeah, there we go. Okay, so the gums are pink and moist. Good. Now, can I have you stick out your tongue as far as you can? This helps flatten it so that I can further depress it with my depressor. Okay, so put that there. Look at the throat wall. For any signs of the tonsils. Do you have your tonsils? Okay. The grunt is fine. Grunting is fine. And let's see. Would you mind just saying for me so I can look at the uvula? Good. Okay. Hard palate, soft palate. Alright. Go ahead and close your mouth. And I just want to look to see how they're doing. Are you experiencing any more irritation? Are they burning at all? Okay. Would you mind telling me if they're sensitive at all to this light? No? Let me just look here. We'll do a little bit of testing to make sure that we clear that up. I think, honestly, you just got some dust in your eyes. I mean, we had the ears. That makes sense. The wind dried it out a bit. Little particulates. But I think that we got it. I'm going to pull down on the eyelid here. Okay, and up. Good. Up on the eyelid. Okay, and down on the eyelid. Alright. So I am going to have you do a few things so we can check that the ears, or the eyes rather, are all clear. I'm going to have you blink a few times. So if you could just do a few blinks here. Blink, blink, blink. Okay. Blink, blink, blink. Blink, blink, blink. Good. Is that irritating at all? Does that feel off in any way? Okay, if you could just give me a couple more. Blink, blink, blink. Blink, blink, blink. Okay, we're going to move your eyes around a little bit. Again, see if anything is irritating. If I could have you just look up. Look up towards the ceiling. Look up. And look down towards the floor. Can you look to the right? Look to the right here. And to the left. Can you look to the left? Okay. Can you look diagonally up here? And diagonally down here. Diagonally down here. And diagonally up. Good. Up. Down. Right. Left. Diagonally down. Diagonally down. Diagonally up. have you look straight ahead, since that light did not irritate you. We're going to bring out the actual light, a little more horsepower to it. Look right here. Just keep looking right here. Good. Looking at our pupillary response here. Good. Keep looking right here. Good. Keep looking ahead. I'm trying to trick your eyes a bit. Good. What if we come up real close? That's a lot, isn't it? It is indeed. Okay. Good. Good. Okay, so can you focus on this light right here? Alright, using only your eyes. Without moving your head, just follow this as it comes in. I know it's quite intense, but we're going to bring this back out. Quite far. Good. And in. And out. And in. And out. And in. And out. In. Okay. Very good. Oh, the eyes do look better. Let's go ahead and just note that down. Right here. Irritated. Good. And then are equal, reactive to the light around, as well as accommodation reflex intact. So cranial nerves 3, 4, and 6. Why don't we move on to the lymph nodes real quick, and then we'll start getting into the heart, lungs, extremities, that sort of thing. So go ahead and start right back here. I'm just going to very gently roll the skin. Behind the ears, in front of the ears, underneath the jaw, submental and submandibular nodes. And along the neck we have the anterior cervical, posterior cervical, and deep cervical chain of nodes, cervical nodes, root word, cervix, cervix, meaning neck. And lastly, supraclavicular above the clavicle here. Okay. Now, why don't we take a little listen to the heart, and then we'll move to the lungs. Let's see what we've got going on here. All right. Okay. Mm-hmm. And right here. Okay. So that was quite fast, actually. So, do you mind just letting me see your wrist, that I can just feel the pulse? Okay, that's pretty quick. Quite quick. Is there any particular reason? Is that fairly normal for your heart rate to be that high? Well, we've been sitting here for a while. Just nerves in general. Okay, so that is fairly normal. Alright, well, why don't we see if we can take that down a notch? So I'm going to re-auscultate the heart after we've listened to the lungs, because we're going to be doing a lot of deep breathing. That might be taking it down a little bit. I am going to do a few things with the lungs here. The very first thing is something called tactile vocal fremitus. And because I will be listening to the lungs, I want to do this bit of palpation here. So I am going to have you say the word 99, and I'm going to feel along the lungs and just feel how the sound of your speech feels in the lungs, how it resonates in the lungs. So if I put my hand right here, I'm just going to have you say the word 99. Other side, 99. And again, 99. 99, 99. Good. Okay. So let's go ahead and do some percussion on the lungs here. I'm going to put my hand on your chest and tap on my finger, and we're going to listen for the sounds that come back. Again, we're looking for resonance. We don't want to hear hyperresonance. We don't want to hear dullness or stony dullness, but instead just a resonant tone. So, start right here. You don't have to do anything special. Just going to tap along the chest, starting from the lung apices and working our way down. And the sound should naturally get a little duller the farther we go down. your arms down. Let's listen to the lungs. So when I put the diaphragm of the stethoscope on your chest, I'm going to have you take a deep inhale and exhale. All right? Okay. So inhale, exhale. Just like that. Very good. Inhale. Exhale. Inhale. Exhale. Inhale. Inhale, exhale. Okay. This is where I'm going to listen to the heart now. So we'll come back to the aortic valve here. There we go. It's a great little tool the body has to be able to get a little bit of manual control over the process. Okay, pulmonary sounds good. How about tricuspid here? A little bit of deep breathing. And then it slows nice and slow. Goes nice and slow. And the mitral valve here. Good. Okay. So we're going to do those tests that I did on your lungs, but on the posterior chest wall. So if I could have you just turn for me so that I can do our tactile vocal fremitus, so we can do the percussion and the auscultation. Okay? While you're here, I'm actually going to start by just looking at the spine, all the way from the cervical spine, thoracic, lumbar, sacrum here. Okay, you're going to feel a little bit of palpation here on the sacrum, just looking for any edema. Okay. Let me see if the hips are aligned here. You'll feel my hands just at the top of the crest. Okay, that's aligned. And the shoulders. Okay, so one of them is just tilted a little bit up. Let's go ahead and just bring that down. Good. That all looks straight. Okay. Would you mind bending forward? Okay. And I'm going to have you very slowly vertebra by vertebra. Come back up to sitting, and that way I can look at each little segment of the spine. Okay, back up, and there we go. Oh, that looks great. Spine looks great. Scapulae, there's no winging here. Looks like they're in the correct place. Okay, so we'll go ahead and come back to the lungs. So I'm going to put my hands on your back like this, and I'm going to have you say 99, 99, 99, 99, 99. Good, and it feels equal on both sides as well. Now we'll do that bit of percussion. Just hold still. Bring the stethoscope back out. We're going to do that deep breathing again. So, I could just have you inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale. Last row. Inhale, exhale, inhale, exhale. If you could turn back around, we're going to use the stethoscope for one last area. Okay, so I'm going to listen to your abdomen here. I'm going to have you breathe normally. And I'm just going to, somewhat briskly, I suppose. It only takes a couple seconds to listen at each spot on the abdomen. I'm going to listen to each of the 4 quadrants. Listening to digestive sounds. And we can do some palpation here on the abdomen. So let me know if any of this feels painful or tender at all. Doing okay so far? Okay. Okay, and if I press right in here, nothing painful. On the spleen, how about more on the liver side? Okay, I'm going to press in towards the kidneys here. And how is that? Okay, and they do not feel enlarged at all. That seems just fine. And now we'll finish off with some percussion here. So, we're marking out borders, listening to areas with fluid versus with air. I'm going to be able to tell when I go over the liver, for example, that's going to sound much more dull than the intestines. Good. And it can give me a gauge of the size of things, what's going on inside. There we go. I know that I had felt your pulse a little bit earlier, but I would like to do that again. I'm going to feel the radial pulse, the ulnar pulse, and the brachial pulse, and the crook of the elbow. I'm going to get a little closer here. Alright, would you mind if I see your hands here? Okay. We'll start with the radial pulse, and the heart rate has certainly gone down quite a bit, which is good. Ulnar pulse. Good, that's palpable. And brachial. Okay. Other side here. The radial. Good strength to it. Good. Ulnar pulse. Palpable. And brachial pulse. Okay, now we're going to move to popliteal. This is behind the knee. It takes both hands. So I'm just going to get under here. And sometimes this one is not palpable, which is okay. Okay, and the other leg here. Popliteal. There it is. Good. And how about post-tib, on the ankle, bilaterally, these are synced up as well. Good. And the top of the feet, dorsalis pedis here. And these are also quite strong. Good. Let's go ahead and check some reflexes. I'm going to use the Tromner hammer here, and we'll use this end right here. we'll start by doing the triceps and biceps reflexes. I'm going to have you take your arm and put the forearm right here along your thigh so that your hand just dangles in the space in between. Okay? Just let it hang. Let it go floppy like a wet towel. And then I'm going to come around to the back of the elbow, and we're going to on the triceps reflex. So make sure that hand is nice and relaxed. Okay, and we are going to just strike this a couple of times. Okay. Here we are. Now, could you flip to the other side? Hand dangling between the legs, forearm resting on the thigh. Good. And again, a few taps here. Okay, good. If I can have you now just show me your arm so that I can hold the elbow. I'll be tapping along my thumb just in the crook of your elbow. Okay, so do 1, 2. Good. And the other arm. Hold the elbow, thumb in the crook of the elbow. Now, the patellar reflex, very easy here. If I could have you just relax the legs, don't have to do anything special here. Good. Okay, we get some good kicks there. Okay, excellent. I want to do a little bit of strength testing here. If I could have you put your arms up like this, okay? So forearms perpendicular to the floor, upper arms parallel. Okay? I'm going to try to pull you towards me. I'd like you to just resist against me here. Okay, go ahead and hold. I'm going to try to push against you. I want you to resist this. Good. I'm going to put my hands on top of your shoulders. I'm going to try to keep them down. I want you to shrug them up against me. Go ahead and shrug up. Okay. Can you keep them up? I'm going to try to push them down. You could just keep them up and hold. Good. Would you mind pinching the tips of my fingers as hard as you can with your first finger and thumb? Good. And can you squeeze my hands as hard as you can? Good, yep, with the whole hands. There we go. Can you put your arms up like this? I'm going to try to push down on your elbows. I want you to hold against me here. Good. I'm going to press down on the tops of your knees. I want you to press your legs up against my hands. Press up. Good. And I'm going to try to pull your lower legs towards me. I'd like you to resist me. Good. I'm going to try to push your lower legs back towards you I want you to resist me here. Good. I'm going to push down on the tops of your feet. I'd like you to just hold against me. And I'm going to try to lift them up. I want you to hold against me here. Okay. Good strength. Let's do a bit of range of movement here. If I could have you open the hands. Close. Open. Close. Good. Can you bring the wrists down and back up? Flex and extend. And turn them in and out. Rotate them in. Rotate them out. Good. Can you lift your arms up above your head? Come backwards as far as you can. Good. From the side, lift the arms up. Backs of the hands touch. Good. Okay. You roll the shoulders back and forward. Good. Bend the arms at the elbow all the way in and out. Okay. Can you kick out your legs? Back and forth. Good. Can you bring the feet up and down? In and out. Rotate in. Rotate out. Very good. Okay. Let's just have a little look at everything. Your skin's probably going to be a little warmer just because we did a bit of movement here. Look at the hands, nails. Look for any abnormalities in the palm, any thickening, wasting, contracture here. Capillary refill. Good, good, good. I'm going to feel the joints here with the backs of my hands, fingers, wrist, elbow, shoulders. And they don't feel warm. Do you mind just showing me the backs of your forearms? No blacks here. Good. And looking at the knee joint, the shins, feet. Do you mind showing me the soles of your feet? A little bit of callousing, nothing crazy. Okay, and your toes. Capillary refill. Good, nails look good. Okay, and toe joints, ankles, knees. Feels just fine. Okay, let's take a peek. So, your eyes are still just have a touch of pinkness to them, but they're much less irritated than they were. We did that. We looked at your ears, cleaned them up a bit. Head, nose, mouth, throat. Looked at the eyes, lymph nodes, heart, lungs, you have any questions for me at all? Okay. And that will be the end of that. I'd like to thank you so much for coming into my office for this examination. You are quite healthy, and I didn't see anything out of the ordinary. And what things I did, we were able to fix real quick. I hope you have a